please can you remind me if you'll be so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? The purple angel, purple angel, purple angel, you're next to me.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. This is Lori LeBay, the host and founder of Alzheimer Speaks, and I welcome you today. We're going to have a fantastic show talking about anxiety, depression, and food, along with Alzheimer's and dementia, and how they're all intertwined. For those of you that are new to the show, my mom had dementia for 30 years, so I walked this journey and lived and braved it for a very, very long time, and I'm still learning, and that's why I started Alzheimer Speaks, is to raise everyone's voice so that we can learn from one another and live more graciously with this disease. So bottom line, we are an advocacy-based company providing multiple platforms to help people shift from crisis to comfort around the world when dealing with dementia. We're also known as a media outlet, helping people expand their brand footprints as well. I have to thank our audience because you guys are so fantastic. You help us in so many ways shift our care culture from crisis to comfort by your likes, your clicks, and your shares. You are powerful entities, and don't for a second ever forget that. So I just want to thank you. And I also want to invite you to be a guest on the show because we want to hear from everybody. Those of you that are having some symptoms, those that are diagnosed, family members, researchers, movie directors, singers, songwriters, authors, advocates, you name it, we want to hear from you because we know that we can't do it alone and we need to hear everyone's voice in order to really shift and make people feel comfortable, raise awareness, and help them all live better with this. Now, you can always find more information out about us at our main website, which is alzheimerspeaks.com. There you'll find our blog, the radio show, our YouTube channel, our social media outlets, and most importantly, our projects and initiatives page, where you can find out information on memory cafes and dementia chats and so many other things like becoming a dementia-friendly business or city. We've just been honored to do so much with people around the world. So again, thank you. Thank you so much. I want to give a shout out before I introduce our guests here today. One is to Dementia Action Alliance. They are having their second North American Dementia Conference. It's going to be in Atlanta, Georgia, June 20th through the 22nd, and you can get more information by going to daanow.org. That's daanow.org. And I'd be amiss if I didn't give a shout out to Dave at Calendar Cards. And Calendar and Cards both start with a K. They have devised a memory system created to help people live independently at home a little bit longer. And they have been really nice and put together a fantastic memory cafe directory, not only for the U.S., which we have over 600 of them listed, and I'm sure they're not all in there yet. So get a hold of him and get yours in there. And if you're looking for one, just go to memorycafedirectory.com. You can also find information in other countries. He's pulling those together as well. Two other things I want to shout out to is the Purple Table Reservations. I love this project. If you are a restaurant owner or if you go to a restaurant, have them reach out to purpletables.com because they are training restaurants how to facilitate their restaurants and how to train their staff and design their restaurants to be more engaging and friendly to those not only with dementia but autism, post-traumatic stress, and so many other variables in a really respectful fashion. And last but not least, I have to mention the Megathon, megathon.us. If you go there, you're going to find out about a really cool research phenomenon that's going on where us as individual citizens can actually be scientists, and we can help analyze their data. And it is just absolutely fabulous. Their goal is for April 13th at 1:30 p.m. Eastern Time to get 100,000 participants and to play a game where you're going to be analyzing real data, which will help researchers answer questions, and to boot, it's going to save them a year in time. Nothing better than that. So go to megathon.us to get a little bit more information on that. Now, let me get to our guest today, because this show is going to be full of wonderful information. Today, we are lucky to have with us two doctors who are speaking at the 3rd Community Wellness Symposium and Gala, which is hosted by the Lotus Health Foundation. And the Symposium and Gala is on March 21st and March 22nd, along with a special event being held March 23rd, all in Rochester, Minnesota. The topics covered in the Symposium are going to emphasize the importance of lifestyle medicine principles, and we're hearing so much more about this. And I love this because this is something that we can control. We can really dig our heels into. And so lifestyle medicine principles are things like nutrition and movement and stress management, keeping socially engaged, living with passion, and monitoring our sleep. And all of these things really impact our general health, along with, this is a great thing for employee wellness, and just bottom line, all of us are our overall brain health. So I'm excited that we have Dr. Neal Barnard with us. And Dr. Barnard is an adjunct associate professor of medicine at the George Washington University School of Medicine in Washington, D.C. And he's also the president of the Physicians Committee for Responsible Medicine. Isn't that just a fabulous title? I love that, and organization. Dr. Barnard has led numerous research studies investigating the effects of diet on diabetes, body weight, and chronic pain. He has authored more than 80 scientific publications and 20 books for medical and both lay readers. And he is also the editor-in-chief of the Nutrition Guide for Clinicians, which is a textbook made available to all U.S. medical students, which is absolutely fabulous. So welcome, Dr. Barnard. How are you doing today?
I'm doing super. It's wonderful to be with you today.
Well, great. I am going to introduce Dr. Neal Nedley next, and then we will get off and running here. But thank you so much for joining us today. Dr. Neal Nedley is a board-certified internal medicine specialist with the emphasis in difficult-to-diagnose patient gastroenterology and mental health issues, and he is the founder and medical director of the Nedley Depression and Anxiety Recovery Programs, with options for home-based versions and community facilitator coached programs, along with a 10-day live-in residential therapeutic program and Optimize Your Brain program, which is designed to enhance emotional intelligence. Dr. Nedley serves as the president of Weimar Institute that houses the famous New Start program and the residential and outpatient depression and anxiety recovery program. So welcome, Dr. Nedley. How are you?
I'm doing great. Thanks for having me.
Well, I am thrilled to have you with us here today. You both are just filled with so much knowledge. I'm just very excited to have you both with us. And I'm going to start with Dr. Barnard. If you wouldn't mind, please telling our audience, people think about Alzheimer's disease as just kind of being an old age thing. And can you tell us why you would disagree with that?
Yes, I think that's such an important issue. People imagine that Alzheimer's disease is based on age and probably on genes, and that there's nothing more to it. And if that's the case, then there isn't anything you can do. You're either going to get it or you can't get it. researchers in Chicago really turned this whole idea on its head. Starting in 1993, they began the Chicago Health and Aging Project, and they tracked Chicagoans, they tracked what they ate, and they looked at who stayed mentally clear and who developed Alzheimer's. And they started to discover that food choices played an enormous role in whether people developed Alzheimer's or not. And it turned out that foods high in saturated fat, that's the fat that predominates in dairy and also in meat, they had a much higher risk. Trans fats in snack foods. There were things that were helpful. Vitamin E-rich foods like nuts or seeds seemed to reduce the risk. And there were many, many other things. So just with that kind of opening the door, researchers have looked at all kinds of food choices that people make, as well as other things like exercise and sleep, and found that the brain is buffeted by all of these things, and if we put them to work, I'm convinced that we can delay or even prevent many, many, many cases of Alzheimer's.
Oh, that is fantastic. Now, Dr. Nedley, can you tell us, what some of the risks are for developing Alzheimer's or other types of dementias?
Well, yeah, this has actually been done now in a number of studies, but if you're a diabetic, if you're obese, if you have high blood pressure, if you're a smoker, if you have depression, if you develop major depression in your younger years, you actually have up to 4-fold increased risk of developing Alzheimer's or dementia, and physical inactivity. And there was actually a meta-analysis where we looked at those combined, and the data actually showed that if we could actually reverse these, which we can through diet and lifestyle choices, over 500,000 cases per year in America of dementia would be completely prevented.
Wow, that's unbelievable. Dr. Barnard, do you want to add anything to that in terms of what some of the causes are and risk factors?
It's been an interesting thing. When the research starts out, you're just observing different things, and you're not 100% sure why these connections exist. For example, diabetes doubles the risk of Alzheimer's. Why? We may not exactly know, but the good news is that you don't really have to know. It suggests that if we make an intervention that helps control diabetes or helps make it go away, then you can tackle the Alzheimer's risk right along with it. Same with smoking, as we just heard. If you put out the cigarettes, your risk of lung cancer goes down, but your risk of Alzheimer's is going to start going down, even if we're not 100% sure why one is linked to the other. So the broad brushstrokes seem to be basically getting the animal products off your plate, more of a plant-based diet. Also, I would say keep the oils that one uses to a minimum and avoid the high saturated fat oils like coconut oil, for example. Have a diet that has robust amounts of vegetables and fruits and whole grains and beans. Some would add nuts and seeds as a source of vitamin E. I would skip the vitamin E supplements. I would use food sources. The supplements just don't seem to act the same way. I would lace up my sneakers about 3 times a week and get a good brisk walk for at least 40 minutes or maybe more than that. Absolutely avoid tobacco. Those are some starters, but there's certainly more to it with regard to the specific foods that might be helpful.
Well, what I love about this conversation today is, so many times, I talk with people all around the world and everyone feels like there's nothing they can do. And the conversation is finally coming out is, yes, there are some things that we can do. And I'm sitting here, at my desk thinking, all right, I have to start really getting stronger at doing a lot more because there's much more that I could be doing, and I have to step up to the table and not just talk about it, but implement some of this stuff myself. And I know that a lot of our listeners are probably feeling the same way there. Now, Dr. Nedley, we see so many cases where people who are having some symptoms go go to the doctor and they are diagnosed with, anxiety or depression, and they're on those medications many times for a couple of years before they're actually diagnosed with dementia. And, most people feel like they were misdiagnosed. Do you feel that, and I know that you can't give me a blatant one way or the other, but do you think people are misdiagnosed, or do you think that that's kind of a precursor to dementia?
Well, interestingly, depression, I think the evidence is now pretty strong that depression can actually bring about dementia. We've had individuals in our program that were misdiagnosed with Alzheimer's, and their memory was so bad they got fired from their work. They couldn't even remember their room when they first came here. But as a result of the depression clearing up, the memory got significantly better, and within 6 weeks they were back to work again, and their memory was restored. And so in some cases, dementia is actually not caused by Alzheimer's, but can be due to advanced and severe depression, and this can be a complication of it. But it is also true that if you have depression earlier in life and don't resolve it, your risk of developing Alzheimer's dementia or permanent irreversible dementia is significantly higher.
Oh, interesting. I just had somebody at one of my memory cafes come in whose wife has dementia, and he said he went to the doctor because he's really worried about his memory. And he took the test, and the doctor said, nope, you don't have it. And, he said, I know that I'm really down. And he was starting to lose some balance, and he said he's leaning to one side, and he's starting to have some tremors, and we said, maybe you need to, get checked for Parkinson's. But it could easily be a combination, and Lord knows I'm not a doctor, but just in terms of signs and symptoms, and was a person who was going to the doctor by himself, and we were really encouraging him to have somebody else go with, kind of as that advocate and second pair of ears. I think that's so important for people when doctors are trying to figure this out. Sometimes all the information isn't given to you, which makes the job even harder to figure out what the heck's going on. Now, Dr. Barnard, do you have anything that you want to add to the whole anxiety and depression and dementia mix? Any other thoughts that you want to add to that?
Well, years ago we thought of mood, whether it's depression or anxiety, which, by the way, are kind of two sides of the same coin. They're not completely different. They coexist in the same individual. We thought of them as having nothing to do with food, nothing to do with lifestyle. It was all just neurotransmitters, and tricyclic antidepressant would get things back to rights. And I have to say, I think that the lifestyle research on this is nowhere near finished. It's an exciting frontier where we need a lot more work. But we did a study a few years ago with Geico, the car insurance company, because their corporate headquarters is near my office. So we instituted a vegan diet at work for Geico employees, which meant that every day there was vegan food served in the company cafeteria, and once a week there was a class or sort of support group for anybody who wanted to jump into this diet. And what we were really trying to track was weight and diabetes and cholesterol and the usual things, the physical things that would come from a diet change. And, of course, everybody got better. They lost weight. If they had diabetes, they improved, and so forth. But along the way, we used paper and pencil tests to rate people's mood. And we found that it started improving. I thought, well, you're in a group and you're getting the support of people once a week. Maybe that's going to make you feel better. Or you're losing weight, and that's got to make people feel better. But other researchers found the same thing. And that was true even if people weren't in a group. It seemed to be something about the foods that people were eating, they were doing better. And then we also tracked absenteeism. We found that people were staying at work as opposed to needing to call in sick. And other researchers have found that when people go toward a diet that is based more on plants, they do better. When people lace up their sneakers, that helps too. And I am personally very excited about the possibility that for people who have absolutely garden variety major depressive disorder, treated by drugs, to the extent that we can implement a really good, healthy lifestyle, and I would have that mean a vegan diet, very natural, healthy foods, help people to exercise, which of course is the last thing you want to do when you're depressed, but people can do it, and there are structures that will allow people to not say no to it. I would love to just see what that'll do for mood, and I think it would be as powerful or more so than medication. And of course could be used with medication if one needed to, but I'm guessing that it would stand on its own.
Wow. I would tend to agree with that. I think, the foods we eat definitely impact us, but we do everything so unconsciously nowadays because life is moving so fast that we're not really aware of, of the effects. We just kind of keep plodding through instead of really sitting back and kind of looking at things and taking it all in. So I think this is such a healthy conversation to have. Now, Dr. Barnard, can you tell us about some of the studies? Are there some specific ones? I know that I interviewed not too long ago somebody who was involved in the finger study, which was really all about lifestyle, and which I found fascinating as well. Are you involved in some other studies that you'd like to share with us?
I have to say, in the world of Alzheimer's disease, my hat is off to the researchers at Rush University. I think they've just done wonderful work. I already mentioned their Chicago Health and Aging Project, which they did, but they've been doing some other studies too, and maybe two highlights. One of the studies looked at diet and Alzheimer's, diet and cognitive decline, really, tracking a group of individuals and just looking at the gradual loss of mental function. And what they zeroed in on in this particular study, or maybe I should say what really emerged as important, was green vegetables, spinach, broccoli, some of the other cruciferous vegetables like broccoli and Brussels sprouts, kale, collards, those kinds of things. And what they found was that people tend to neglect these foods overall. These are the ones, that people ignore their mothers' entreaties that they eat their vegetables. And so people kind of ignore them. But those people who didn't ignore their mother's advice and actually ate them, 1 to 2 servings a day, so we're not talking about a huge amount, they were spared cognitive decline to the equivalent of 11 years of aging, meaning if you looked at people the same age, let's say you're talking about 80 years of age, the people who ate 1 to 2 servings of green vegetables a day were the equivalent of age, say, 69, compared to 80 for the vegetable avoiders. So eating your greens saves you about 11 years of aging. The other part of this was, when you're looking at what's bad for the brain, iron consumption. We all grew up with this notion that, the more iron you get, the better. Well, iron rusts if it's in your fry pan that you left in the picnic table, before a rainstorm or something like that. Iron also oxidizes in your body, and as it does, it releases free radicals that can damage the brain. So researchers have looked at iron's role in the brain and found that it may or may not contribute as a cause of Alzheimer's. But evidence suggests that if people have Alzheimer's, having a high iron intake causes the disease to have a much more aggressive course. So, what are the iron-rich foods? Your cast iron fry pan is one. It'll impart iron into your foods, but also meat, liver, the things we wanted to avoid because they have the bad fats. It turns out their iron might be part of the toxicity as well. If you're taking multiple vitamins that have iron added, now's the time to throw them away, unless you actually are iron deficient, in which case that's a different story. But the good news of this is these are all things we can control. You can decide if you're going to have vegetables or not. You can decide to shield yourself from these iron sources that people hadn't realized might be contributing to their loss of brain function.
Wow, that's really interesting. I remember interviewing one gal who she actually lost two children to dementia, which I know people say is pretty rare. And she said one of the things with her son was that he just had such a high level of irons and different metals in his brain, and they couldn't figure out where he was getting them from. And, I think he passed away like at 21, and I think her daughter at like 17 or 18. And it's just so sad because, we're putting stuff in that we've been told is safe and good and healthy. And so now there's kind of this unlearning process of, what do we do? Or even with our restaurants, everything's upsized and larger. And so, it's the same price. Okay, we'll take it. We get used to doing that, and then we start eating it all. And when we don't really need it. And so, we've been, as a society, in some ways, I think, tricked through marketing with things. And it's nice to have these conversations now about, the what ifs and what can we do. And I love this. I love the studies on lifestyle. I just think, again, that it's so empowering to people. Now, Dr. Nedley, do you have anything that you'd like to add in terms of food or supplements in terms of dementia or anxiety or depression?
Well, yes, actually Harvard study over 100,000 nurses that they've been following over time. And they took a look at dementia and what the nurses were eating. And they found out berries, particularly blueberries and strawberries, were associated with significantly improved memory and decreased cognitive decline in older women. And then they actually took a look at how much they had to eat. The berries themselves decreased or actually backed up your memory to 2.5 years earlier by just getting enough of those. But what was enough? In their study, just one serving of blueberries a week produced that benefit in 2 servings a week of strawberries. So sometimes It's not something that we have to do every day. The greens are good every day, as Dr. Barnard stated, but the anthocyanins in blueberries have been shown to actually go into the hippocampal area, which is the area of memory. There'll actually be a blue hue in the brain after eating blueberries, and those are very protective, high in antioxidants, and it seemed to protect the memory portions of the brain.
Okay. What are your feelings, Dr. Nedley, on nutritional supplements? Have you done any studies regarding that?
We know that in general, getting our antioxidants from our fruits and vegetables is actually superior than taking the antioxidants in pills. The antioxidants in pills can have some positive effect, particularly if you don't have many antioxidants at all in your diet. So it's probably better to take, the A, C, and E than not if you're on a typical American diet that's high in meat and saturated fat. But it actually is far superior to switch over to a plant-based diet. A cup of kale, for instance, that has 50 milligrams of vitamin C and 13 units of vitamin E actually has the antioxidant potential of 1,100 milligrams of vitamin C and like 400 units of vitamin E. And so we do far better by getting the antioxidants from the vegetables themselves, just because they have so many other phytochemicals that help us out in a lot of ways that we don't even understand yet.
Okay, great. Thank you. Now, Dr. Barnard, I know that you are very plant-based. And what is your take on the supplements? I know earlier you had said you could probably throw out the vitamin E, and I know I still take it to this day, and I take it for absolutely no valid reason other than when my dad had cancer, they couldn't believe he lived so long, and they're like, "What are you giving him?" And I'm like, my intuition told me to give him a bunch of vitamin E, and he lived for 4 more years, way longer than they thought, and was doing excellent. So I take that supplement based on that, but with no scientific background at all. So can you tell us your thoughts on nutritional supplements?
Sure. Well, I agree with what Dr. Nedley said, and an overall emphasis on foods rather than pills is going in the right direction. And there's a couple of reasons for that. With regard to vitamin E, there's not just one form. There are 8 different forms of vitamin E in nature. And in the Chicago study, what they found is that when people got vitamin E from foods like almonds or walnuts or sesame seeds, they got a benefit. But if they took it in the form of pills, it didn't seem to work. And the reason we think that's true is, let's say, if you get an almond and you eat it, you're getting all 8 forms of vitamin E. But if you take a vitamin E pill, they can label it vitamin E if it has only 1 form or 2 forms. And if you overdose on 1 or 2 forms of vitamin E, they can suppress your absorption of the others. So you can be doing yourself more harm than good. But if you get them from foods, you're doing better. Now, one caveat, nuts are addicting. So if you have a handful of smokehouse almonds, that's likely to be followed by another handful, and pretty soon, the scale is ratcheting up in the wrong direction. So my answer to that is have foods in a natural form, say raw nuts. You're not going to overdo it with that, and use them not as a food but as a flavoring. So you put the nuts on your morning cereal, your morning oatmeal, whatever it is, and use them in that way, about an ounce a day. A couple of other supplements that I think should be mentioned. One is vitamin B12. As you said, I was not raised on a vegan diet, but I have adopted one, and frankly, it's the way to go. But you really should take a vitamin B12 supplement. And frankly, this is true of everybody, not just people on a vegan diet, but anybody should take B12. You need it for healthy nerves and healthy blood. It's not made by animals or plants. Many people run deficient on it. And you need 2.4 micrograms per day. All the supplements are bigger than that, but you just get the smallest one that you can find and take it every day, and you'll be hopefully okay with B12. Vitamin D is normally coming from the sun on your skin, and it helps you absorb calcium. But if you live in Rochester, Minnesota, and it's March, you may not be out basking in the sun too much. So in that case, yeah, you know what I'm talking about. Yep. Or if you live in sunny southern Florida but you use sunscreen, then the sunlight no longer makes vitamin D in your skin. Back when we lived in equatorial Africa, the sunlight on the skin would make all the vitamin D a person could ever use. But if that's not available to you, 2,000 international units a day in a supplement is what probably most people would think is safe. So I'm going to say B12 for everybody, D if you're not getting regular sun, and the rest is really going to come from food.
Okay. Well, interesting. And, when you mentioned the sunscreen, I never even thought about that affecting our absorption of that, of vitamin D. I just never even occurred to me. So thank you so much for stating that. Now, you had mentioned about, fatty foods, implications there, but you had also mentioned specifically coconut oil, which, there's been so much about use coconut oil, and you just said, you can throw that off. Can you expand on that?
Yeah. Coconut oil is terrific for waxing your shoes. It's really great for maybe making your car have a nice sheen, but I would never eat it, and I encourage people to avoid it. And if you put it in a jar, if you look at a jar of coconut fat, go to the store and have a look at it. It's a waxy solid. And there is so much hype in marketing, not just about this, but about lots of foods. And we have to really read between the lines. The coconut oil manufacturers will say, it's high in saturated fat. But it has a magical property where, despite that, it won't raise your cholesterol. Well, the studies just show that it does. It does raise your cholesterol. Now, you can argue whether it's better or worse than butter, but I think the answer is not to eat either one. So you don't need oils in your diet at all, really, apart from the natural traces of oils that are found in vegetables and beans and little bits in fruits, and there's more in nuts and seeds, and those provide the essential fatty acids that your body really needs. But the coconut oil, it's what you're seeing is marketing, and it's not just the coconut oil manufacturers. A few years ago it was pomegranate juice, and all the studies coming out about how fabulous that is, and it's industry driven. The egg industry is trying to push its products. The dairy industry pushes its products. The wine industry is always trying to say how wine is good for this and good for that. One has to look at the studies and carefully see where the evidence leads.
Okay, well, that's great. Dr. Nedley, anything you want to add to what Dr. Barnard just talked about?
Yeah, I would second that regarding coconut oil. We've had a lot of individuals come through our program that are really trying to eat healthy. They've seen the studies on it, and they're actually vegetarian. But if they're a healthy vegetarian, their cholesterol will normally be less than 100 plus their age. And we will see them come in with cholesterols of 250, 260, and they say, I'm vegetarian. Why is this happening? And then we go through the oils, and yes, they have, bought into the coconut oil craze. So they're putting it on everything, and that increases their liver's production of cholesterol significantly. And when we get that out of their diet, their cholesterols fall to less than 100 plus year age, which is actually a healthy cholesterol to be at. And that was the only change they made.
What do you suggest people cook with? A lot of people use coconut oil or butter or Pam or whatever, so things don't stick to their skillets and to their pans. What do you suggest they use in that instance?
Well, I think the least amount that we can utilize and still be able to, cook our food would be the best way to go. In reality, cooking oils can have its problems in regards to how it changes the characteristic of it. So, if we utilize oils in the healthiest way possible, I would second what Dr. Barnard said in regards to getting it from the fruits and vegetables. But, if we're going to use oil separately, extra virgin cold pressed olive oil would not be, that would be the safest way to go. Or some oils that are more in the cold pressed state that are not saturated, like coconut and palm oil and the tropical oils are.
Okay, wonderful. I've actually found my coconut oil has been great just for softening my hands and my face. I've been using it more with that than cooking and stuff lately. So it's kind of an interesting process there. Now, Dr. Nedley, I want to talk to you about, lifestyle aspects that are influencing depression and anxiety and dementia. And can you dive a little bit deeper into what do you think are triggers and what do you think people can do to step out of those?
Yes, actually, we underscored 10 major categories of causes of depression and anxiety. And when we find those causes and reverse them, that's when we can get the dramatic response that we get in our clinical programs. So diet is one of those 10 categories. There's lifestyle issues like getting enough light, getting enough aerobic exercise, even working with your hands in 3 dimensions has some significant brain advantages because it enhances circulation of the front part of the brain, which is the part of the brain that's most suppressed when you have depression and anxiety. And then there are other lifestyle habits that actually seem to bring about depression. In fact, at an exponential rate, when you're on screens a lot. The iPhone, once that was introduced in 2007, and particularly when over half of households had it in 2012, rates of depression and anxiety started to skyrocket. Even self-harm has significantly increased. And it actually drives the brain to not be able to focus over time. And as we talk about dementia and focus, there's another term that you might have heard of called digital dementia, where this is where our young people in particular are so used to being distracted all of the time, they get on their computer or maybe their phone to look up something, and then, a Snapchat comes in and then someone texts, and so their brain is never really being able to have focused attention for more than a few minutes. And the area of our brain that requires focused attention is identical to the area of our brain that is utilized to manage distressing emotions. And so their ability to handle emotional distress is also significantly depressed. So when they actually come to our program, although they think they're going to get worse because they think they've been treating their depression and anxiety with their phones, we actually take their phones away from them for 10 days. and explain it, of course, and go through all the research and show them what's going to happen. But they are amazed at how much better they get with a comprehensive program that has a plant-based diet without their continual distraction element. Their focused attention goes up, and when they leave here, even their academic performance dramatically improves, and their ability to remember things goes up. Another issue with these screens is what we call the Google effect, and that is people are actually learning and memorizing less than ever before in human history because they think if they need to know something, they'll just Google it or look it up. But that actually decreases our brain's ability and practice in regards to remembering things. And the less well-stocked our memories are, the more gullible we become. And this is also why the new generation is being called the most gullible generation, because they don't have a brain that's well-stocked with important facts that they can refer back to in a number of important critical situations.
Well, it's interesting that you brought up the digital dementia, because Dr. Krista just interviewed me for that, and I came on as a layperson because I don't have any study evidence. But at first I thought, well, I'm not really appropriate to speak on this, and then I took a look, and it was like, oh my gosh, when you really sit back and look at the effects of technology on us, it's pretty shocking. And are you part of that summit at all that's going to launch in May, Dr. Nedley?
I'm not part of that. No, I'm not part of that summit. We hold an emotional intelligence summit at WEMAR every year, but we've had great researchers in this area explain how important it is. Victoria Dunkley, she's an adolescent psychiatrist, for instance, in Los Angeles, and she has done a number of studies, and she says she won't diagnose any young person with any mental illness until they give up their screens for 6 weeks, because it often normalizes after that.
Wow.
And presented very powerful evidence in regards to that. And then also there's some general population studies showing that the happiest people in the world are the ones having real life experiences and are utilizing digital media for less than an hour a day. So that should be our goal, particularly on the entertainment side of things.
Yeah, it's interesting, though, because with dementia, I know I work a lot with people around the world that are diagnosed, and to them it's really a lifeline, and it helps on that social engagement piece in terms of giving them purpose. And they say they've never felt so empowered, and some of them have been living 15 and 20 years with the disease and are still able to, they're adopting and adapting as symptoms progress, but it's really helped them, stay engaged. But it's a very interesting conversation. Dr. Barnard, anything you want to add on digital dementia, and have you seen or studied anything regarding that? Oops. Dr. Barnard, are you there? Can you start
yes,
over?
Can you hear me?
Okay. Yep.
Yes, I'm sorry.
Yep.
Okay, sorry. Dr. Nedley blew me away when you talked about getting people away from their digital equipment, and I think he's absolutely right in the effect of these things, and yet people are so addicted to it. I wonder, it must be such a challenge to get people to give it up. What I also see is that people tend to be very much reactive, as opposed to thinking creatively and coming up with things on their own. They're sort of waiting for what text message comes in that they have to react to. So I was quite impressed by what he said, and I think he's spot on.
Yeah, it's a very, very interesting topic, and if either of you two are interested in Dr. Krista's summit coming up, I'd be more than glad to connect you two, because I think you could both add a lot to the conversation. I think it's one
Wonderful.
that we need to have. Now, Dr. Barnard, can you talk? You've talked about lacing up those sneakers and stuff. Can you tell us about the effects of exercise and on the brain and on the body?
There was a really influential study done at the University of Illinois where they brought in people who had the beginnings of memory problems. They were still themselves, and they might be handling their checkbook and maybe driving and whatever, but they knew their memories were faulty. Specifically, they would have lapses. Words and names would fall out of their memory. And that'll happen to all of us, especially if you're sleep deprived and stressed. But for these people, it was sort of an everyday thing, and we call that mild cognitive impairment. Brought the people in. They did brain scans. They looked at the hippocampus, the seat of memory, and for most people, it shrinks over time. And they did a number of tests to assess their cognitive function. And then they did an intervention, which was a 10-minute walk 3 times a week. Anybody can do that. Brisk walk, though. Let's get the speed up. And then the next week it was 15 minutes. And the next week it was 20 minutes. And then 25. And finally, when they got up to a 40-minute brisk walk 3 times a week, they kept at that with that routine for 12 months. And then everybody went back in and they scanned their brains. And the hippocampus had, on average, stopped shrinking and started expanding in these individuals, and their cognitive function was better. And so why? The short answer is I don't know why, but I am going to speculate that this kind of exercise oxygenates the brain, brings the nutrients to the brain, helps the brain to rid itself of toxic products. There's all in all just cardiovascular fitness is improved through this, and whatever is good for the heart and blood vessels tends to be good for the brain as well. So it's not diet or exercise. It's let's do both of these things simultaneously, a good healthy diet and a good regular exercise pattern, and see what we can do.
Wow. So that makes a lot of sense. Dr. Nedley, I know that you talked about exercise as well with depression and anxiety. Anything you want to add to that?
Yeah. Of course, in our program that we utilize, we do recommend an hour of good aerobic physical exercise a day. That's where we keep getting exponential benefits the longer we go, like 15 is better than 10 and 20 is better than 15. But after an hour, we still actually get more benefits after an hour, but it becomes linear and not so much exponential as far as the brain health benefits. The other aspect of things that I would like to mention, and there's now a number of studies supporting this, is when we are working with our hands in 3 dimensions, like gardening, or even washing dishes, or playing ping pong. When there is that 3-dimensional, even repetitive type of motion, we actually get even a little better brain benefit than the aerobic exercise by itself. Now, we recommend both because the fitness aspect of the aerobic exercise is crucial for overall brain health. But we tend to neglect the actual working with our hands, and with our society becoming more 2-dimensional with screens, we're not seeing that type of benefit. And so, in fact, a lot of studies are indicating there's probably nothing more superior than gardening, where we're actually having to hoe and plant and pick and be involved in 3-dimensional activity on a regular basis that actually produces some significant brain benefits.
Well, good. I'll get back into that as soon as the snow melts and the weather gets nice. I definitely love to get out there and get in the garden, and I think so many others do as well. But we don't think about the benefits all the time that enhance us. Now, I want to talk about sleep too, and this has come up. I remember seeing Dr. Rudy Tanzi say, he loved the fact he was a multitasker and he could go on 4 or 5 hours sleep, and studies have come out that no, we need more sleep than that, and multitasking isn't all it's set up to be. What are your thoughts on that, Dr. Nedley?
Oh, sleep is crucial, and what we do in our program is to reset their body clock. In fact, the number one treatment for insomnia is drugs here in America, and many of those drugs are actually frontal lobe suppressants. The most commonly used drugs are your benzodiazepines, which are short-term gain, long-term problem, because you eventually develop a tolerance to those, and then you can't sleep even with them. and then you have all of those side effects regarding frontal lobe suppression that occur. But instead of that, we really like to reset the body clock with light. Now, in the summertime in Minnesota, that's not going to be too much of a problem. If you get up early and you get outside, you're going to have that 460 nanometer wavelength light from the blue sky, and that is what can really help set the body clock. And so in our program, we actually utilize a medical-grade light box first thing in the morning, and within 7 days, most people with depression and anxiety are late-night people. They don't really want to go to bed, and when they get up, they feel like a zombie in the morning, and they just think this is the way they are, that they're genetically programmed that way. But I can turn any individual from a late-night person into a morning-time person with a light box, and then they get very efficient, restful sleep, and when they wake up in the morning, they're energetic, and they're ready for the day, and they're excited about the day. And so that's one of the modalities we utilize to help with the restorative sleep. Of course, the exercise also helps. Not eating, right before going to bed will also produce more benefit. But at least 7 hours if they're adults. And if they're young adults, it's going to be more than 8 hours a day of good, efficient sleep, and particularly centering in on the early to bed, early to rise. One study showed if we change our sleep patterns that way, it's actually superior to taking Prozac if we have depression. It actually gets rid of negative thoughts better than the antidepressants.
Wonderful. Dr. Barnard, anything you want to add on sleep?
My favorite medical device is a clock. When the clock strikes 10, go to sleep. I'm one of these people where I think this book is too good. I'm going to read this last chapter, and pretty soon it's 10:20 and 10:40 and 11:05, and or this documentary is too great, or I got this project due tomorrow, or whatever. But I have discovered if you just kind of push yourself a little bit, when the clock strikes 10, turn off the light, go to sleep. You're going to do dramatically better. And for people who struggle with this, if you don't mind my mentioning this, I wrote a book called Power Foods for the Brain that has a sleep chapter. And it's designed for all those people who either have trouble going to sleep or they wake up in the middle of the night and can't go back to sleep. There's some really simple sleep hygiene things that a person can do to get a decent night's sleep. And it just makes you feel young again to be able to be well rested. And if you're not well rested, you will eat anything just to get through the day. So it's not just a sleep problem. People give up their exercise if they're not well rested. They give up their healthy diet, and everything kind of falls apart from there.
That's really good. I think I need to get that book. I'm one where I stay up and I'm watching late night TV, but I'm still pounding on my keyboard doing work. And, last night I think I was up till almost 2:30 trying to get some things finished and stuff. So I know I'm one of those that needs to do much, much better in that area. Can't believe we've only got about 7 minutes left. This has been such a fascinating conversation. Dr. Barnard, what are your thoughts about medications and the effect on the brain?
There was a doctor named Dwayne Gravelin who completely changed the whole world on this. Dwayne Gravelin is a physician in Florida. He worked for NASA. And he got in his car at work, went home. When he got to his house, there was a woman standing outside, and he said, "May I help you?" And she said, "What do you mean, may you help me? What are you talking about?" And he said, "Well, this is my house, and is there something you need?" And she looked at him and said, "Dwayne, I'm your wife. Don't you recognize me? What is it?" And she packs him into the car. They go to the emergency room, and they discover that he's got huge gaps in his memory, and lots of things, including not knowing who his own wife was. So anyway, they do a lot more elaborate testing. And the only cause they can figure is that about a month or so earlier, he had started taking Lipitor, a atorvastatin. It's the most common statin for cholesterol lowering. So they stop the statin. His memory gets back. It recovers. but his cholesterol goes back up too. So he restarts the Lipitor at half the dose, and within a month his memory was wiped out. Everything after the age of 13 was gone. So the Lipitor was thrown in the trash, his memory comes back, and they write to the FDA and say statins are safe, they're helpful, they have certainly clinical indications, but look at this effect. The FDA discounted this initially, but there have been thousands of cases now of people who had exactly the same problem. So Lipitor is just one example. And I don't mean to say this is a common effect. It's not. It's quite rare. And for a person who is following a healthy diet and they still have a high cholesterol, there is a role for statins. But I should say that 90% of people on statins do not really need them. They are taking them because they're eating cheeseburgers and chicken and other things that cause their cholesterol levels to rise. And if they would have a healthy diet, the statin would be in the trash for them too. Many other drugs affect brain function. And so the lesson is, if a person has an acute change in mental status of any kind, go into the bathroom and open up the medicine cabinet and see what's new. And it can be a new drug, or it can be a combination that hadn't been used before. And so now the medications are adding together. But every doctor knows this, that drugs are number one when it comes to some new symptom, some new CNS, central nervous system symptom. And yet, doctors are often just adding new medications without really looking very carefully at non-drug ways of treating these conditions.
Well, and people can, my understanding is, go to their pharmacist and ask them to analyze their drugs that they're taking for side effects, because sometimes I've been told doctors don't always know, the interactions between them, but the pharmacists usually have a pretty good clue on that, and then they can bring that back to their doctor and make adjustments if needed. And I think that that's a service that's really underutilized. And I think, in this fast-paced life, everyone's looking for the quick fix, which is a pill, and yet there can be so many complications sometimes from that medication. Anything, Dr. Nedley, that you want to add regarding medications?
Well, in regards to depression and anxiety, the medications actually that are trying to work in the synapse are actually not improving our ability to make serotonin or serotonin receptors, or to make norepinephrine or dopamine or whatever chemical we're trying to do. They're actually blocking reuptake channels, meaning that they're plugging the vacuum cleaners in the releasing neuron. And that can help short term, but it ends up, when we are plugging the vacuum cleaners that are picking up the serotonin, for instance, over time, the neuron will actually become even more depleted of serotonin, and that was the problem to begin with. And so that's why we need to actually come up with better ways and actually doing things to improve serotonin production, which diet and lifestyle can do. It can improve the receptors, and we'll have a far better response. Now, in regards to Alzheimer's, the drugs, of course, do not really reverse the underlying condition, but there are alternatives that when patients don't, are not notified of. There was a study, a 16-week randomized placebo-controlled trial of patients with moderate Alzheimer's disease, and they were actually given, instead of the leading drug, although one of the arms was given the leading drug, but the other arm was actually given saffron, which is a spice, and of course it's, we get it from a flower. But it worked as well as the leading drug in treating Alzheimer's, but without any of the side effects of the leading drug. And there is evidence that it actually inhibits some of the amyloid beta protein development. There have also been some studies on turmeric helping out in ways that the drugs don't help out with. And so it's sometimes important to search for alternatives that can have the same effect without the side effects and without the need for monitoring that we have to do with these drugs on a regular basis.
Wonderful. Well, I have to thank you both, and we've got to wrap up. I could talk with you all day, and audience, you could listen to these guys for a full day at their symposium. So check out the Community of Wellness Symposium in Gala, March 21st through the 22nd, and then the Lifestyle Medicine Approach to Improve Brain Health and Overcome Addictions on the 23rd. You've got the links on the page here, so click away and take advantage of these two phenomenal men doing wonderful work. Their contact information is also listed. And again, I can't thank you both enough for spending this hour with us. It's just a fabulous conversation. Thank you.
Thank you
so much.
Bye now, everyone. We'll catch you next time.
Hi, this is Suzanne Newman, host of the Answers for Elders podcast and radio show. We are the North Star that guides you through the complicated journey of senior care with trusted experts in money, law, living solutions, and more. So join us on this station, your favorite podcast channel, or just go to AnswersForElders.com. Meet the Wayshowers who will help your journey go a lot easier.